Coming back to the issue of mobile towers and, of course, whether mobiles are safe for all of us or not. Now, in the city of Mumbai itself, for example, there are 1,800 illegal cell phone towers according to the civic body, and many of them have been mushroomed just out of the blue, and that's the reason why actors like we have actors like Juhi Chawla, who has really opposed this entire thing and has been campaigning against illegal towers in the city. But what about those who say and claim that they are really feeling the effect of the cancerous radiation that they are feeling now?
It's not that I'm against cell phone towers. What I'm against is clusters of cell phone towers placed, situated irresponsibly within, meters of people's homes, offices, schools, hospitals.
1,800 illegal cell phone towers across Mumbai that have got actress Juhi Chawla and citizens worried. The fear of ill effects from radiation so strong, this teacher believes it's caused her cancer.
बाद में लास्ट ईयर एक बार फिर से गई थी, तभी डॉक्टर ने पूछा टावर्स किधर है क्या नज़दीक पास, तो मैंने बोला हमने स्कूल के पास है कर, तो सोचने लगे मैं उससे भी आ सकता है ऐसा बोले.
While there is no directly proven case of ailments being caused due to radiation from cell phone towers, the correlation cannot be ignored. Experts explain the confusion caused as the controversy over what's safe and what's not rages on, especially after the release of an international report in 2012 on the harm caused by radiation. The report rubbished by India's cellular industry, but doctors differ.
However low the intensity, if the duration is long, it can be harmful.
There is no health hazards from the towers and handsets when they are functioning at the prescribed safety levels set up.
There is enough evidence whereby we have noted that there can be chromosomal damage which eventually has been known to be carcinogenic or cancer producing.
We really don't know where the continuing concern arises from. There may be some vested interest at play in this particular issue.
The last word on health hazards still not out. For now, the civic body says it's awaiting a nod from the courts to remove these towers. In Mumbai, with camera person Bapu Wag and Rajesh Sonar, Saurabh Gupta, NDTV.
Well, the recent controversy started after a team of doctors and scientists came up with what's known as the BIOINITIATIVE Report 2012, which says that they have reinforced scientific evidence of the risk from exposure to mobile radiation. They also insist the range of possible health risks has broadened from their report in 2007. So what can really affect you? They claim cell phones, cordless phones, Wi-Fi, wireless laptops and many other electronic appliances. The health risks, they insist, are enormous. Damage to the DNA, to sperms, to the nervous system, cancer, even insomnia, memory loss and increase in brain tumors. Children, of course, being more vulnerable. Well, we have an eminent panel joining us to discuss this entire issue. Joining us here in Mumbai, we have Dr. Ashish Mehta, spinal neurological surgeon here in Breach Candy, here in Mumbai. Joining us from Delhi, we have Mr. Rajan Matthews, Director General, Cellular Operations Association of India. And from Hyderabad, we have Dr. Vijayalakshmi, Professor at the University of Texas. We'll also be joined by Juhi Chawla, actor, who has, of course, been at the forefront of the campaign against cell phone towers, illegal cell phone towers. Let me start with you, Mr. Mehta. You're a doctor. Do you get patients and do you have scientific proof and evidence which will say that yes, proximity to cell phone towers and radiation of electromagnetic waves can cause ill effects on the human body?
Yes, over a period of time there has been adequate evidence which shows that any living tissue which is exposed to the microwave range of radiation can have ill effects because of exposure. However small the dosage can be, the duration exposure can also affect the tissues.
So would you believe that this report, BIOINITIATIVE report, is worth its salt then?
2012 report, yes.
Well, there are many who don't agree with you, like Mr. Rajan Matthews. Sir, if I can ask you this question then, that what does one really do? Because here you have a doctor saying who is an experienced person from the scientific field. He comes, he says he has patients who come with problems, and he believes that this is the reason why this report really should be implemented. The electromagnetic waves, the limit should be reduced to what they are recommending, 0.03%. Why would you really oppose it? Because at the end of the day, whatever Mr. Mehta may say, the scientific community is divided. There is no conclusive data on this still.
First of all, I think let's be clear as to what we are talking about. We are sympathetic to the concerns of the citizens, and we are, of course, working with the government to ensure that the health of the citizens are taken care of. But the BIOINITIATIVE report, which started off in 2007 and which has been updated in 2012, has been completely debunked by the majority of folks who actually studied this, like the WHO, like ICNIRP, and by public health agencies all over the globe, as most recently as April 2012 in the UK, which looked at all of the evidence to date. So we have other doctors that will tell you quite differently in terms of what has been represented just right now. And so when you look at the full gamut, you have to ask yourself, who are you going to believe? Obviously, there are opinions on both sides, scientific evidence that is being cited in two extremes, and we have to ask then, who is the credible voice? And we believe that the government of India has chosen to listen to the WHO, which is, we believe, the credible voice in this particular situation.
India's #1 news app just got even better. Download NDTV's new app. Fully optimized for retina display. Full screen view. Faster response time. And Sudoku. NDTV's new iPad app. Download now.